Request our chair for this session, Nikhil, to take over. And Nikhil will first start this session and talk to us on what does the healthcare industry need to do to catch up with the needs of the consumer, particularly the digital consumer, the interface over there. Nikhil, it's all yours. I think we need to have those microphones, and as that is getting set, once again may I request all the speakers, please stick to your time.
Hey, yeah. Good morning everybody and welcome back. I'm sure you can grab a cup of coffee, tea and come back. This is going to be a very interesting session. We have got stalwarts and tall leaders of healthcare industry. It's a great honor and pleasure for me to chair this session amongst all the healthcare leaders of the industry. And I must also thank Dr. Rajen Gupta for inviting me in. And I must have a disclaimer. I'm not from a healthcare industry, and I'm not a doctor. But what I have done over the last 2.5 decades is look at the close journey of different market developments and also observe closely the changing consumer and its impact on different industries. In the beginning of this session, I think Sanjeev rightly said, it's not the word patient, but it's all about consumers. And rightly so, because as the consumers evolve, they're going through a different digital experience and they have a different expectations from different services and solutions that they pick up. And the same is the expectation from the healthcare industry. So today, coming from data and analytics industry, I'm going to share some of the trends that might be quite relevant for this specific session of managing chronic diseases in the digital age. If you look at publications from WHO, from ICMR, from National Health Policy, there are many statistics of rising and exploding healthcare-related issues, especially on the chronic diseases. When I say almost 2/3 of the Indian population is going to have healthcare-related issues which are due to sedentary lifestyle, almost half of the deaths that happen in India are because of the chronic diseases. Now, these are definitely population scale problems, and this means that it requires a population scale solution as well. The second development that I see across the world is development of internet. Almost 6 out of 10 people on this planet have access to internet. Now, what does that mean? That this is another explosion which is happening. So on one side we see that there are going to be chronic diseases rising across the planet. On the second side, we also see that there are going to be explosion of the internet. Now these two developments are definitely showing us some indication and some correlation. And we'll have to connect these dots as we move forward. The third lens to look at is definitely the consumer angle, which everybody in the healthcare sector call patients. And there are 4 key trends that are emerging. One is around safety, second is around staying connected, third is about sustainability, and fourth is simple and easy way of living life. Now with these 4 developments, a lot of organizations have got zillions of opportunities. These trends have actually disrupted. These trends have also kind of displaced many organizations and created new organizations. So this is very important to see first how these 3 things are interlocking. And more importantly, if you look at the overall population, we're talking about 8 billion population on this planet, and in next 2 decades, it is predicted that almost everybody will become digitally literate. Everybody will have a digital tool in their hand. And I think this is an inflection point for healthcare industry, because when this happens, the healthcare industry has to take off a major population scale problems. And I think these of the things are becoming so important. And we looked at a kind of study in India where almost 72% of urban India people said that good health is their priority. Now, if good health is the priority of citizens of India, I think it's an equal responsibility of healthcare industry to make this dream into a reality. And therefore, there are three things which are very important. Peter Drucker said, if you can't measure it, you can't improve it. So, first and foremost is the measurement in this whole space of healthcare. And second is connecting with the consumer. And third is really act on the improvement. And when I see the measurement part of it, there are so many things that are really happening. So, in the month of January 2023, there were almost 21 million apps that were downloaded related to healthcare and fitness. Now, that's a big deal, which means people are really started measuring things. Over last 1 year in India, there were 71,000 new applications that were rolled out related to healthcare and fitness. And guess what? It's the new generation which is really catching it fast. It's the millennials which are really adopting it. And over a period of time, it's going to be ubiquitous. And secondly, I think if you look at from the device side, we already see that the need for measurement is becoming much more stronger, where the devices are now enabled with so many biometric things where one can really see how things are coming, whether it's about oxygen, blood pressure, ECG, and many other things. And I think that's where I think the next movement and next shift is going to happen. And I think this was clearly laid out in the Google session. And there are two sides of the whole story. One is the demand side, and second is from the supply side. On the left-hand side, you will see that almost half of the global consumers are looking at 24/7 diagnosis and which can be addressed by the healthcare providers. And they're also looking at kind of smart devices which can actually feed in this information for the improvement. On the right-hand side, you will see that there are definitely focuses. Of course, there are developed markets like America and Europe, but this really needs to address the problem of the developing countries. And this is, I think, a supply and a demand equation which needs to be addressed now. And coming back to this topic of managing the chronic disease, I think these 6 dimensions of wellness needs to be interlocked with the digital solutions available. So whether it's about the better health, fitness, nutrition, better appearance, sleep, and I think mindfulness, which is the important thing which has come up after the pandemic. So in my opinion, I think in today's session, we're going to hear from the leaders. There are 2 big issues to be addressed by the digital healthcare industry. One is on the activation, and the second is scaling. When I say activation, it's about what's kind of available right now. Virtual care, remote monitoring. Can applications become part of our business as usual for the healthcare industry, which means everybody kind of operates on this? And the second is the scaling part. And the scaling is how do we really invest in the digital literacy and training. And I think one of the initiatives with Digital Health Academy is doing is bringing this education for the healthcare industry overall. There's a lot more collaboration that is needed with the tech companies, and I think Google is a prime example where there was a discussion about partnership and not really overtaking the healthcare industry. And third, I think the most powerful tool to manage and really transform the kind of healthcare industry is usage of AI, big data, and analytics, because this is where one can really monitor, one can measure, one can really go for the digital solution for treatments. Now with this, I invite my fellow speakers to share their views on how things are changing and what are the ways to really manage the chronic diseases in the digital age. Thank you very much.